So as was said, my name is Eric Hausman, and I work at the New York City Department for the Aging with their HIICAP program. It's HIICAP. And HIICAP has volunteer counselors that help people with questions on Medicare and related health insurance. And if you or anybody in New York City ever has a question on Medicare, you can reach one of our counselors by calling the Department for the Aging. It's 212-AGING-NYC, which is 212-244-6469. And you'll see that at the end of the presentation again. And ask for HIICAP for anything Medicare. So I'm going to provide an overview of the Medicare program, a couple of changes for this year. And after each section of the presentation, I'm happy to stop and take any questions before we continue. So starting from the very top, you may know that Medicare is a federal health insurance program. Mostly it's for people that are age 65 and over. And whenever I meet people that are turning 65, which is very common nowadays, I always ask them, are you collecting Social Security? Because I know if somebody's collecting a Social Security benefit prior to 65, they're going to be automatically enrolled in Medicare. But nowadays, a lot of people are choosing to collect Social Security after 65. And for them, enrollment in Medicare is not automatic. It's up to them to enroll in their Medicare Part B medical insurance during one of the Part B enrollment periods. The first enrollment period is called the initial enrollment period. This is when people are first eligible for Medicare. It's a 7-month period. For most people, it's the 7 months surrounding the month they turn 65. If you enroll in Medicare in any of the 3 months prior to the month you turn 65, Medicare starts the first of the month you turn 65. If you enroll in Medicare Part B the month you turn 65 or one of the next 3 months, Part B starts the first of the next month. Now, for some people, when they turn 65, they're still working. Or they're covered under a spouse, not a domestic partner, but a spouse that they're married to at 65 who's still working, especially if they're working for a large employer where the employer insurance would be their primary, their main insurance. They may want to delay enrollment in Part B at 65. Why? To save the monthly Part B premium. If that's the case and you are covered at 65 under your own or your spouse's active current employment, not retiree plan, not COBRA, but active current employment, you could delay Part B and then enroll later using what they call the special enrollment period. So for instance, if you're turning 65, but you're still covered under your spouse who's working for the city of New York, you could delay Part B. A couple of years later, when your spouse is ready to retire, sign up for Part B then. And that's very common for people that are still working or covered under a spouse is still working for a large employer when they turn 65. Now, for those that don't sign up during their initial enrollment period, who don't qualify or maybe miss the special enrollment period, and then realize later, sometimes years later, they need Part B, they make them wait till an annual period to sign up. It's called the general enrollment period. Every year, January through March. If you sign up for Part B then, Part B starts the next month, but you may be subject to a late enrollment penalty. The late enrollment penalty for Part B, it's calculated as 10% of that year's standard premium for every full 12 months you delay. And that 10, 20, 30, 40, 50, 100% or more penalty, it's not a one-time penalty. It is a lifetime penalty. So I just want to stress to everybody, the only people that can delay Part B at 65 and sign up later without having to wait and without being subject to a penalty are the people that are covered at 65 under their own or their spouse's active current employment. And then once you do enroll in Medicare, they send you this red, white, and blue Medicare card in the mail. Shows you the 2 parts of Medicare. Medicare Part A is your hospital insurance, covers you if you ever need to be admitted to the hospital. Medicare Part B is your medical insurance, covers you mostly for doctor's services. So before I talk about the cost of Medicare, are there any questions about enrollment?
Pretty straightforward.
It
So I'll
sounds
continue that.
complicated.
It can be sometimes, it depends on the individual situation, right? For some people, it's easier than others, but that's why we're here to help people to navigate Medicare.
Okay, thank you.
Sure, you're welcome. So a big part of the thing to know about Medicare is the cost of Medicare. Hey, what is it going to cost you when you have Medicare out of your pocket? Well, first of all, there's a monthly premium for Part B. Now, Part A, the hospital insurance, most people get that for free, but no premium. Part B, they pay for. So this year, the standard Part B premium that most people pay is $185 a month. If you're collecting Social Security, they'll take it out of your check. If not, they'll bill you directly. Besides a monthly premium for Part B, there's an annual deductible. This year, it's $257. That means the first $257 in covered medical expenses, that's your responsibility. Once you meet the deductible for most services, Medicare pays 80% of what they allow. You're responsible for the other 20%, the Medicare co-insurance. Now, it's different for lab tests and for most of the preventive services that Medicare covers, things like the flu vaccine, pneumonia, screening mammography. Those are all covered 100% by Medicare. But most every service, whether it's surgery or anesthesia, office visit, mental health, physical therapy, they're all paid under Medicare Part B at 80% of what they allow once you have met the annual Part B deductible. On the Part A side, things work very differently. Although most everyone gets Part A for free, for no premium, there's a large deductible if you need to be admitted to the hospital. This goes up every year. So this year, for a hospital admission of up to 60 days, Medicare pays everything but the deductible, $1,676. If you're in the hospital beyond 60 days, for the 61st through the 90th day in the hospital, you're responsible for a daily copayment. This year, $419 per day. If you think that's a lot, if you're in the hospital beyond 90 days, Medicare allows an additional 60, what they call lifetime reserve days, which you can use once during the lifetime of your Medicare coverage in any combination. But once you've used them, that's it. They're non-renewable. For those 60 lifetime reserve days, you're responsible for a daily copayment, $838. Again, that's per day. If you discharge from the hospital to a skilled nursing facility for rehab care, Medicare will pay the first 20 days there in full, but the next 80 days you're responsible for a daily copayment. This year, $209.50, and again, that's per day. And these Part A benefits, they're not a calendar year benefit like Medicare Part B. Part B is fairly simple. You got one deductible, $257 this year. Once you've met it, that's it. You're done for the year. But the Part A deductible, somebody may have to meet that more than once in the same calendar year because it's once per what they call a benefit period. A benefit period begins the first day you're admitted to the hospital, and it ends when you've been out of the hospital, out of the skilled nursing facility for a period of at least 60 consecutive days, at which point your benefits renew. They start again. So for example, let's say you had to be admitted to the hospital tomorrow for 5 days. Medicare is going to pay everything except this deductible, $1,676. But what if in July you need to be readmitted to the hospital or a different hospital? Same condition, different condition, doesn't matter. Less than 60 days have gone by since you were discharged. You're still in the same benefit period. You just pick up where you left off at day number 6 of your first 60 days of coverage. You don't have to meet a new deductible. You don't. But what about instead of being readmitted in July? What if you're readmitted at the end of the year? October, November, December. More than 60 days have gone by. Still the same calendar year, but now it's a new benefit period. You're back to day number 1 of your first 60 days of coverage. and you have to meet a new deductible, $1,676. So I hope this slide will help to point out the importance of people having other insurance besides Medicare. As for people that have Medicare only, you could see they could wind up paying a lot out of pocket, especially for hospitalization. And when I talk later about privately purchased Medigap, Medicare Supplement insurance, you'll see how that fills in nicely here. And that's a big reason why someone would purchase that type of insurance. So far today, I'm talking about one way to get Medicare: original, traditional, fee-for-service, straight, regular Medicare. Part A hospital, Part B medical, and about gaps in coverage, deductibles, co-insurance. Another gap in original Medicare are services that Medicare just doesn't pay for at all. These are the more common services, including dental care. Medicare does not cover a routine vision exam. They do not pay for eyeglasses. One exception, they'll pay for a pair following cataract surgery. Otherwise, they don't cover eyeglasses. They don't cover hearing aids. And important to know, Medicare doesn't cover long-term care. Medicare covers what you saw on the last slide, short-term rehab care in a skilled nursing facility following a hospital discharge. Also important to know is that Medicare doesn't cover a routine annual physical exam. You might have seen where they cover something called an annual wellness visit. That's a much more limited exam. A comprehensive head-to-toe annual physical exam, never been covered under original traditional Medicare.
Wow.
Also good to know is that Medicare does not cover services outside of the United States and its territories, like Puerto Rico. So if you're traveling through Europe, Asia, Africa, even across Canada or Mexico, even in the event of an emergency, Medicare will not pay for those services at all, not at all. Now, for those that are on original traditional Medicare, some folks have retiree health insurance from their own or their spouse's former employer that helps fill in these gaps in Medicare. So for instance, we speak to a lot of retirees of the city of New York, retired teachers, CUNY professors, and others. Most, but not all of them, who have Medicare have the GHI senior care that works as a supplement to Medicare. It's actually a combination of two insurance companies. Anthem, which is Blue Cross and Blue Shield, supplements the Part A, and GHI, which is Emblem, supplements the Part B. The GHI senior care does not cover the Part B deductible, plus they have their own $50 deductible on top of that. Once you meet the two deductibles, prior to this year, they used to pay the whole 20% Part B co-insurance, but this year they have new $15 co-payments for office visits and for many services. For those that don't have retiree health insurance, some of those individuals have very limited income and resources, and they might have Medicaid in addition to Medicare, where so long as their providers take both Medicare and Medicaid, they don't have any out-of-pocket cost for covered doctor and hospital services. But nowadays, most people don't have retiree health insurance. Most people don't qualify for Medicaid. So what do? They can purchase a private Medigap, a Medicare supplement plan. You may have seen them advertised on TV from AARP. Before I talk about Medigap, are there any questions about the cost of Medicare? So Medigap insurance, again, is for people that don't have the retiree health insurance and who don't have Medicaid. They can purchase a private plan to help fill in the gaps in Medicare that we spoke about. Medigap plans are identified by letter. There are 10 standard plans ranging from plan letter A to plan letter N as in Nancy. All Medigap plans cover certain things. They all cover days 61 through 90 in the hospital at $419 a day this year. They all cover the 60 lifetime reserve days at $838 per day, Plus, if you exhaust your Part A benefits, they all cover you for an additional 365 days of inpatient care. They all do that. Most Medigap plans pay the Part A deductible, that's $1,676 deductible. Most Medigap plans pay the entire 20% Part B coinsurance, and then other benefits vary from plan to plan. But let me tell you the two most important things to know about Medigap insurance. One is that the benefits are standard. So different companies sell these plans, and they charge different amounts, but as long as it's the same letter plan, doesn't matter what they're charging. Exactly the same coverage, exactly the same. So it's well worth your while to shop around for the best deal on a Medigap plan. The other thing to know that's very important in New York State, unlike most states, we have continuous open enrollment for Medigap insurance. So as long as you have Part A and Part B and you're on original Medicare, if you live in this state, you could always purchase a Medigap plan. And if you have one already, you could always switch to another plan. You cannot be denied Medigap insurance because of your age or because of your health, not in New York. Although you can buy a plan at any time, though, you may be subject to a waiting period for pre-existing conditions of up to 6 months. So that means they'll sell you a plan, but they may not cover a service related to a medical condition you had prior to purchasing the policy for up to that first 6 months. However, again, most people we meet are able to avoid the waiting period because they've had some sort of credible coverage that can count towards that. And that could be most anything. It could be another Medigap plan. It could be a Medicare Advantage plan I'll talk about later. Could be an employer plan, retiree plan, COBRA. Okay? As long as there's no break in coverage or a short break of less than 63 days from when that insurance ends and the Medigap plan begins, they credit the time with the prior coverage towards meeting the waiting period. So for instance, if you've been on some sort of retiree plan the last 10, 15 years, all of a sudden you lose that insurance, you buy a Medigap plan right away, you don't have to worry about pre-existing conditions. They will credit the time with the prior coverage towards meeting that. And if you want to see a complete listing of all the Medigap insurers in our area, the plans that they offer, the waiting periods, and most important, the current rates, you can go to the New York State Department of Financial Services. This is the link to the website, where they have a chart that they update each month to make sure you're always looking at the most current rates. We also have our own publication at the Department for the Aging on Medicare and health insurance that works with Medicare. If you're interested in receiving that, you could just email us to get a copy mailed to you. And this includes a chart to show you the 10 standard Medigap plans, A through N, and the benefits that each plan offers. Now, I just want to point out a couple of things from this chart. First of all, you may notice that there are two plans, Plan C and Plan F. Plan F being the most comprehensive plan. Those are the only two plans that cover the Part B deductible. That was that $257 deductible I mentioned earlier. Those plans, C and F, are only available to people that became Medicare eligible prior to 2020. Okay, so if you're just turning 65 today, you do not have the right to get C or F. You can get D or G, which you see is the same plan, just doesn't cover the deductible. But the most comprehensive plan, F, again, only available for people that were Medicare eligible prior to 2020. So whenever I'm talking to somebody new to Medicare, I always talk to them about Plan G, because that's the most comprehensive plan they can buy. But it's expensive. If somebody's looking for a lower cost Medigap plan, I would then move to Plan N as in Nancy. If you move from G to N, the main difference with Plan N is for office visits. Instead of covering the entire 20% coinsurance, like Plan G and most plans do, for office visits with Plan N, you have a copayment of up to $20. But because you do, they're able to offer that plan at a lower premium. But if you're looking for the cheapest Medigap plan possible, that's the high deductible version of Plan F or Plan G. You notice those plans have an asterisk next to it? That's because there's a second version of these plans. Covers everything the standard F or G covers, but before they pay anything, you have to meet a deductible. This year, the deductible, $2,870. So if you have the high deductible F or G and you're admitted to the hospital, that $1,676 Part A deductible would go towards the $2,870. The $257 Part B deductible would go towards that. The 20% coinsurance, the same thing. And if you reach the deductible, you would have all the benefits of the standard F or G for the remainder of the calendar year, while saving on the premium over the course of the year. So talking about premiums, this is a chart also from our book, which shows you, as of the beginning of this year, a complete listing of all the Medigap insurers, the plans that they offer, and exactly how much they cost per month. But again, remember that the same letter plan provides the same coverage no matter who you buy it from. So if you look at the bottom of the chart, let's say Plan N, as in Nancy. Emblem is selling it for $264 a month. Humana is selling it for $430.95. You know what the difference is? There is no difference. Exactly the same. And sometimes people say to me, well, they're charging so much more. It must be the network of providers, right? No, that's not right at all. There is no network of providers with Medigap plans. As long as Medicare pays, Medigap plan pays to supplement that. It doesn't matter what plan you have from what insurer. Medicare pays, Medigap plan pays. Okay, and you need to know that when you're shopping for this type of insurance. Are there questions about Medigap, Medicare supplements?
Terminology wise, is Medigap the same thing as supplemental, the terms?
Yeah, Medigap, or another name for it is Medicare Supplement.
Okay.
And that refers to these 10 standard plans.
Okay. Thank you.
Sure, you're welcome.
And you can you change which plan from year to year? Like say 1 year you're using D, and a following year, can you switch to M?
If you live in New York State, we have open enrollment all the time. So you could always move from one letter plan to another, if not with the same insurance company, by going to a different insurance company. You cannot be denied Medigap insurance because of your age or your health, not in New York State.
Thanks.
So far today, I spoke about one way to get Medicare, original traditional Medicare, which can come along with supplemental insurance through a former employer, through Medicaid, or a private Medigap supplement plan. This is the other way to get Medicare, to join a Medicare Advantage plan, a Medicare health plan. These are private plans that are contracted with Medicare to provide all of your Medicare benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that accept that plan. These are the companies that send you so much mail, right? Especially in the fall of each year, whether it's Aetna or Emblem or Anthem or Elder Plan or Cigna or Centris Plan or Health First or Humana or Metro Plus or United Healthcare or DNS Health, WellCare. Many companies offer those plans. Most everybody's eligible to join. You just have to have A and B of Medicare, and you have to live in the service area of the plan. That's it. But unlike Medigap insurance, which we said, if you live in New York State and you're on original Medicare, you can get a plan at any time, switch from one insurer to another at any time. But Medicare Advantage, for most people, there's only certain times of the year that they're able to sign up or switch. So first of all, you can enroll in a Medicare Advantage plan when you're first eligible for Medicare and enrolled in Part A and Part B. If you don't, or maybe you did, but now you want to switch, most people have to wait till the annual election period. That's every year, October 15th to December 7th. If you enroll in a plan then, your new plan starts January 1st. If you realize in January that was a mistake, there's another enrollment period specific to Medicare Advantage, the first 3 months of each year, the open enrollment period, January through March, where anybody that's in a Medicare Advantage plan has one additional opportunity to either switch to another Advantage plan or to switch to original Medicare. One time, the first 3 months of the year to start the first of the next month. After March, for most people, whatever plan they're in, if they're in a plan at all, that's what they're going to have for the rest of the year. And it's important to remember, if you join a Medicare Advantage plan, you're not giving up your Medicare benefits. These private plans are required to cover whatever Medicare covers, plus, as an incentive to join, they will cover to a limited extent some services Medicare doesn't pay for. So they typically provide limited coverage towards dental, towards eyeglasses, towards a hearing aid. They probably pay for that routine physical that Medicare doesn't. They might pay for a gym membership for you, all things not covered by Medicare. But what I think is the biggest incentive, especially in our area, is that plans may be available for as low as zero premium. You may see them advertised, zero premium. You're still going to pay that Part B premium, that $185 or whatever you're paying for Part B. They're saying zero additional premium. And that could be a powerful incentive, I would think, for people that don't have retiree coverage and who don't have Medicaid and can't afford or don't want to pay $300 or more a month for the typical Medigap plan. You might want a zero premium Advantage plan instead. But even if the plan has no premium, that doesn't mean the plan has no cost for you. It's going to cost you on the other end when you access care, usually in the form of a copayment. So many plans have no copayments for primary care doctors, but they all have copayments for specialists. Some are $20 or $25, others are twice as much. If you're admitted to the hospital, plans may have a daily copayment up to a maximum number of days, $200, $300, $400 or more per day for the first 3, 5, 6 days in the hospital. If you need physical therapy, you might have a $20 or $40 copayment. The bottom line with the Medicare Advantage plan is not 100% coverage for most services under most plans, and you're going to pay something at the end of the day when you access care up to a maximum out-of-pocket for the year, abbreviated MOOP. All Medicare Advantage plans have, as a protection for members, a limit on what it could cost you out of pocket for Part A and Part B covered services, not to exceed this year $93.50 in network. So if you have a plan with the $93.50 limit and it's $50 every time you go to the specialist, the $50 goes towards that. If you're admitted to the hospital, it's $400 a day for the first 3 days, $1,200 out of your pocket goes towards that. If you reach the limit, most people won't, but if you do, 100% coverage for the rest of the year for all Part A and Part B covered services. That's the highest limit any plan can have that year, this year. Some plans have that limit, other plans have lower limits. And that's something you might want to compare when you're shopping Medicare Advantage plans. Another thing to compare is the type of plans. Historically, for us in New York City, it's been mostly HMO plans. With an HMO plan, unless it's an emergency, you're limited to doctors and hospitals that participate, that take that plan. If you go outside the network, you're going to wind up paying the costs out of pocket. But now more and more companies are offering PPO, Preferred Provider Organization plan. Like the HMO, they have a network of doctors and hospitals. And if you use their providers, you'll pay whatever copayment the plan has. The big difference with the PPO, you can go outside of their network to doctors and hospitals that take Medicare, but just don't accept the plan. And you might pay more when you do. You might even have to pay up front and then seek reimbursement from the plan. But for that reason, the PPO gives you more choice, more flexibility than does the stricter HMO plan. And we also speak with many people that have both Medicare and Medicaid, what they call dual eligible beneficiaries. These individuals are eligible to join a special type of Medicare Advantage plan called a Special Needs Plan, SNP. This type of plan, all the doctors in network are taking both Medicare and Medicaid. So as long as the services are covered by the plan, you have no copayments. for doctor and hospital services. In addition to some of the usual extra benefits you get with the plan, some plans may offer more significant over-the-counter benefits, where they might give you a card that you can use at a pharmacy or order items through a catalog for non-prescription drugs, things like vitamins, over-the-counter medicines. You might even be able to use it for food or utilities. Yeah, but people can't join or shouldn't join a special needs plan just for the OTC benefit, because when you join one of these Medicare Advantage plans, you're putting away your red, white, and blue Medicare card, and instead you're getting all your Medicare benefits through a network of doctors and hospitals, through doctors and hospitals that participate, that take that plan. Are there questions about Medicare Advantage?
Yeah, so if I'm understanding correctly, I saw on your slide that you still have to have Medicare Part A and B for the Medicare
Correct.
Advantage plan, correct?
Correct. In order to be eligible for the Medicare Advantage plan, you must have both Part A and Part B of Medicare. But the way I like to look at the Advantage plan is it's taking the place of the government Medicare program. Okay? So instead of, again, using the regular, if you will, Medicare, you're getting your Medicare benefits, including Part A and Part B doctor and hospital services, through Aetna or through Health First and providers that are in their network. It's another way of getting your Medicare.
Okay, but there's a penalty, right? If you decide to go with Medicare Advantage initially and decide 2 years down the road you want to go to Medicare, correct?
There will be no penalty, no. So if you're enrolled in Medicare Part B and Part A when you're first eligible, and you take an Advantage plan, you could always switch during those 2 enrollment periods I mentioned to original Medicare, and you would not be penalized. And as long as you live in New York State, you could buy a Medigap plan if you switch. And although Medigap plans can have waiting periods for pre-existing conditions, they will credit the time that you're with the Medicare Advantage plan towards meeting that. So in the end, you wouldn't be subject to that waiting period. Okay, so you would not, there's no penalty for you for choosing Medicare Advantage and then switching later to original Medicare.
Okay. Thanks.
You're welcome. Let's talk next about Part D. D is for the drug coverage. There are 2 ways to get Part D. If you're in a Medicare Advantage plan, Part D is easy. You must get it from that plan. So if you're going to be on Health First, you're going to get your drug coverage from Health First. If you're going to be on WellCare, you'll get your drug coverage from WellCare. Because when you go with a Medicare Advantage plan, you get all your Medicare benefits. Part A hospital, Part B medical, Part D drug, all from one plan. If instead you choose original traditional Medicare, you could purchase a separate standalone drug plan to go along with that. This year, they have 12 of those plans to choose from. Those 12 plans each have their own formulary, their own list of covered drugs. They don't all necessarily cover all your drugs. And they got their own network of pharmacies. Pharmacy you like, maybe they don't take all 12 plans. How do you compare? You have to go to the Medicare website, medicare.gov. You can enter your drugs in your pharmacy and see which plan would be the lowest cost for you. If you're not comfortable using the website, you can call Medicare, 1-800-MEDICARE, which is available all the time, 24/7. If you want local assistance, that's us, the HIICAP program. Okay? Our counselors are all very familiar with the website. And what we tell people is you can't just make this comparison once in your lifetime and think that you're done. Because these plans can and do change every year. So everybody on the phone today that's on a Medicare Advantage plan, that's on a Part D drug plan, a few months from now, at the end of September, they're going to send you a notice about changes for next year. They're going to update this website October 1. And then you or somebody else should make that comparison again. And if you find there's a better plan for next year, the time to sign up, October 15th to December 7th, to start January 1. Now, what do these 12 plans cost? Well, first of all, there's a monthly premium. The cheapest plan this year from WellCare, it's a little less than $40 a month, but other plans are over $100 a month. So it varies. Besides a monthly premium, plans can have a deductible. This year it could be as high as $590. Many plans have a $590 deductible. Some have a lesser deductible. Some zero deductible. Once you meet the deductible, if any, people usually pay a fixed copayment, a set dollar amount at the pharmacy, until, here's the big change in Medicare for this year. For this year, for the first time ever, Medicare has an annual out-of-pocket limit for Part D covered drugs, not to exceed $2,000. So what does that $2,000 include? Not your premium, okay? It does not include the premium. It includes what you pay at the pharmacy, deductible, copay, co-insurance. If you reach that $2,000 for covered drugs, it's 100% coverage for the rest of the year for all Part D covered drugs. Connected to that $2,000 limit is something else new for this year, the Medicare prescription payment plan, where if you sign up for this, and all plans offer this benefit, if you enroll, then you will pay nothing, zero at the pharmacy for covered drugs. Instead, the plan will take that $2,000 and spread it out into monthly payments over the course of the year, and then bill you for your share of the $2,000 each month, the same way they bill you for the monthly premium. So this could be really good for somebody who otherwise, it takes really expensive Part D covered drugs and might have to pay $2,000 out of pocket in the first month or 2 or 3 of the year. They don't have to. When they sign up for this, again, still the same $2,000, but they can spread it out over the course of the year to make it easier to finance. Okay. Are there questions about Part D drug coverage?
Are you required to have Part D?
Part D is voluntary.
Yeah.
It's optional. Nobody's required to have Part D, but here's the other side of it. If you don't enroll in Part D when you're first eligible for Medicare, and you choose to enroll later, and you don't have other what they call creditable drug coverage from another source, such as some people have through a former employer or union, then you would be subject to a late enrollment penalty. Okay, so again, the late enrollment penalty, it's just for the people that don't sign up for Part D when they're first eligible for Medicare, who choose to sign up later, and again, who don't have other credible drug coverage from another source. So for the people here today that do not have retiree health insurance, who do not have Medicaid, here are your 2 choices in Medicare. So let's compare. It's either original Medicare with a Medigap plan, or it's a Medicare Advantage plan. It's one or the other. That's what it comes down to.
Yeah.
Why would somebody choose original Medicare with the Medigap? Choice of providers. You can go to any hospital across the country, they all take Medicare, as do most doctors. And depending on the Medigap plan, it could be pretty complete coverage between the 2. What's the downside? High premium for the Medigap plan, plus doesn't cover your drugs. You need to buy a separate Part D drug plan for another premium. So the people on the left here, they're paying 3 premiums every month. One for Part B, they're going to pay anyway. A second for the Medigap plan. A third for the Part D drug plan. So they pay the most in premiums, but in exchange, the most choice of providers, the most complete coverage. What about the other choice instead? Medicare Advantage. Why would you choose that? You save on those premiums. Still got to pay the Part B premium, but some plans are no additional premium. They include the drug coverage. You don't need a separate drug plan. You don't need the Medigap, you save on those premiums, plus you get some extras that Medicare doesn't cover, like dental and vision and hearing and the gym membership. What's the downside? If it's an HMO plan especially, unless it's an emergency, you're limited to doctors and hospitals that participate. And even if you don't pay a premium, we said you pay on the other end. When you access care, co-payment or co-insurance for most services under most plans, up to a maximum out of pocket for the year. Plus, this is managed care. They cover your mental health and your physical therapy and your planned surgery, but you may need to get pre-approval, prior authorization before those services will be covered. So for some people, they do better with original Medicare. Other people do very well with the Advantage plan. And that's the choice for all people with Medicare to make. And if you need help making the comparison, that's the main part of the counseling that we do, is helping people compare their options in Medicare. So please feel free to call us. Another part of what we do as counselors is we screen people and help them to apply for other programs that might assist them with their Medicare costs. One of these programs is called Extra Help, or the Low Income Subsidy, LIS. That's a subsidy the government provides to help people with their Part D drug costs. Most people we see get this automatically because they have either Medicare and Medicaid, and or they're on one of the Medicare savings programs I'll talk about, where the state pays their Part B premium, not taken out of their monthly Social Security check. If that's the case, they will get Extra Help automatically, where they will get a subsidy that will pay their Part D plan premium. So they get a Part D plan for zero premium, no deductible, and only small copayments for their drugs, up to the numbers you see here on the slide. If somebody has limited income and limited resources below these numbers, and they don't have Medicaid or are not on a Medicare savings program, they won't get this assistance automatically, but they can apply. The place they would apply to, Social Security. Another benefit of Extra Help, unlike most people who can only change their plan at the end of the year, during that October 15th to December 7th, people with Extra Help can actually enroll in a new Part D plan, any of those 12 standalone Part D plans that work with original Medicare at any time of the year, to start the first of the next month. They're not locked into a Part D plan for the year. Another program, which is exclusive to us in New York, is called the EPIC program, EPIC. EPIC is for New York State residents that are 65 and over, that have incomes going all the way up to $75,000 for a single, $100,000 for a married couple. EPIC does not work on its own, though. EPIC only works as a supplement to your Part D drug plan. And it works with every Part D plan, whether you have a Part D plan through your Medicare Advantage plan, or you have one of those 12 with original Medicare, doesn't matter. It's all Part D, where Part D pays first, and then EPIC wraps around. EPIC helps to fill in the gaps in coverage. EPIC will not help with the Part D plan deductible, though, which we said this year could be up to $590. EPIC's not paying that. But once you meet the deductible, if any, EPIC can help lower your copayments. And you know what EPIC costs? For most people, it's free. So to give you an idea, if you're a single person, you had an income from last year. They always look at last year's income when talk about EPIC. Last year, if your income was between $20,000 and $75,000, like it was for many people in New York, you would be in EPIC's deductible plan. You don't have to pay anything for EPIC. It's free. But you'll have to meet a deductible on a sliding scale based on your income before EPIC will pay for your drugs. But if you're somebody that has Part D and you have an income, let's say, as a single person, $30,000, $40,000, $50,000, $60,000, $70,000, I don't see any reason for you not to sign up for EPIC. Because sometimes people say to me, I don't want to sign up for EPIC because the deductible is $1,000 or more. I don't take a lot of drugs. I'm never going to meet the deductible. But I would say, so what? You don't meet the deductible. It's free coverage. In the meantime, you have EPIC in place should your situation change. And let me tell you one more benefit of Epic. Unlike most people who can only change their plan the end of the year, Epic members can change their Part D plan, including a Medicare Advantage plan with Part D, one additional time each year outside of the enrollment period. So we help a lot of people apply for Epic, not for the drug coverage at all, but just to be able to change plans without having to wait till the next year. And if you're not an Epic member already, you can sign up anytime. We have paper applications for Epic, which we're happy to send to you, or they have a new online application where you can apply at this link in the slide. And then finally, but most important, is the Medicare Savings Program. The Medicare Savings Program pays your Part B premium for people that are eligible and apply. It puts that $185 back into your Social Security check. If you know somebody that has Part B and they're not paying the premium, they're already on the Medicare Savings Program. But if not, they may qualify. The New York State, a couple of years ago, raised the income limits for the Medicare Savings Programs, so many more people are eligible now than ever before. As you can see here, there are two programs. The first is called the QMB program. Those are the income limits up to $1,820 a month for a single, $2,453 a month for a couple. That program not only pays the Part B premium, but it also acts as a supplement to Medicare, in that it eliminates your responsibility for any Part A or Part B cost sharing. So for instance, if you're in original Medicare and you also have QMB, doctors are not allowed to bill you that 20% coinsurance. They have to write it off. If your income is higher than that, but it's less than $2,446 for a single, $3,299 a month for a couple, the QI program pays the Part B premium. And a couple of advantages, other advantages to living in New York State. Unlike most states, we don't have an asset or resource test for the Medicare Savings Program. So whatever money you have in the bank, not concerned about that, only income to qualify. On top of that, even if your income is a little too high, you might still qualify. Because if you're paying privately for health insurance, they allow you to deduct your health insurance premiums from your income to be eligible. Now, you cannot deduct the Part B premium, but this program pays the Part B premium. So they look at your gross Social Security before the premium comes out. But other premiums you can deduct, most commonly a Medigap premium. So for instance, if you're single and your income's $2,700 a month, but you're paying $300 a month for your AARP Medigap plan, you can deduct that $300. Now you're eligible. You know, sometimes we see people whose income's only slightly above the limit, $5, $10, $15. For that person, it'd be worth it to buy some cheap dental policy or vision policy for $20 or $25 a month, whether you need it or not, just to have that deduction. Because paying that $25 a month, now you're saving $185 a month. Plus, you're getting the extra help with Part D, where you have no premium, no deductible, small copayments. On top of that, if you have Epic, Epic will take those small extra health copayments and reduce them further to an even $3 at the pharmacy. So these are the people that do best in New York State, the people that qualify and apply for the Medicare Savings Program. We help people apply in person at our office at 2 Lafayette Street near City Hall by appointment. And we could also, if you live further away, we can also direct you to one of our partner programs around the city. And even if you're not eligible yourself, you may know people that can qualify. Let them know that they can apply for this program like Epic and the extra help at any time of the year, regardless of whether they get Medicare through original Medicare or a Medicare Advantage plan. Are there any questions about these programs that help with Medicare costs? So lastly for today, I just want to provide you with some resources. Again, anybody in New York City that has questions on Medicare can reach us at the Department for the Aging. That's the 212 number there. For those that live outside of New York City within the state, they can call the statewide phone number, the 800 number, and put in their zip code to be directed to a local counselor. If you live outside of New York State or planning a move outside of New York State, you can go to the shiphelp.org website to find a local SHIP counselor, that's the federal name for our program, anywhere in the United States. If you'd like to learn more about Medicare, we offer free Introduction to Medicare webinars. You can see our schedule and register to attend at this link. If you prefer in-person workshops, we have those at 2 Lafayette Street. Upcoming ones are June 24th at 2:30 and July 11th at 10. If you're interested in attending, I'll put my email address in the chat, and you're welcome to email me to register and or share that information with others, again, who would be interested in learning more about Medicare. So I hope you found the information today to be helpful, and I'm happy to stay on if there's any additional questions that you have.
All right. Thank you very much.
I do have
You're
one
welcome.
question.
Go ahead.
Sure. I was on I'm a Presbyterian minister through the Board of Pensions of the Presbyterian Church, and I assume it was Supplement. I was on Humana. Well, most of my doctors are affiliated with Mount Sinai here in New York. Well, then I got a letter from Mount Sinai saying that they were no longer going to take Humana. And so then I mean, hospitals can do that. I mean, just say, well, we're not going to.
Yeah, if you're in a Medicare Advantage plan, which it sounds like what you were in with the Humana, they have a network of providers, if it's an HMO plan especially. So you're limited to the providers you can see, but providers, and then if your provider stops taking the plan as you experience, that does not allow you then to make a change to another plan just for that reason. So you would have to switch to different providers that Humana is still participating in, or it's possible that you may be able to switch to, if you have Epic, for instance, to switch to another insurer. But you're getting your Humana plan as a retiree benefit, is that correct?
I was still paying something for it, but still, it was good question.
It was, yeah, the reason I'm asking that is if you're getting retiree health insurance, benefit from where you used to work, then you don't want to sign up for a Medicare plan in the private market, because that could jeopardize your retiree health insurance, because you probably can't have both. Okay, so you want to be careful about that before signing up for another plan, it would not cause you to lose any retiree health insurance benefits you might have.
So now I got someone to help, who knows something about this, but so he helped me to switch to the AARP United Health supplement, where I can go to any doctor. Well,
Okay, you've already made that change.
Yeah, was smart change or?
Well, the advantage of making that change that you did is now you have more choice of providers.
Right.
Because now you can use any hospital across the country. They all take Medicare, as do most doctors. The downside of your change is the premium you have to pay for the Medigap plan.
Okay.
And you're also paying a premium for a separate drug plan, I'm sure.
Yes. So
I see in the chat somebody asked to getting copies of the slides. I shared with the University Settlement with the a PDF of the slides, which they're welcome to share with anyone. Okay. I also shared with them a link to a survey and evaluation, which we would appreciate you taking a few minutes to let us know how the training was for you today. Thank you.
Oh, could I ask one more question?
Yes, sir.
So I'm taking a trip out of the country this fall. what do I do about then, insurance? If I
And you're taking a trip outside of the United States and its
yeah,
territories?
yeah.
So with your supplement plan, most supplement plans pay for foreign travel emergency services.
Okay, okay.
Most of them. Do you know which letter plan that you have?
No, I have to look.
Okay, I could show you on the slide.
Yeah.
And again, if you'd like to receive our book, which includes the slides and a lot of information, just email me and I'll mail that to you. Okay? So this Medigap plans, you see foreign travel emergency services
Mhm.
covered under C, D, F, G, M, and N.
Okay,
Because Medicare itself will not cover you at all for a service outside the United States and its territories.
right. Thank you for telling me that too. Yeah.
Okay, you're welcome. So as long as you have one of those 6 plans,
Mhm.
then you have that coverage.
Okay, thank you.
Okay, you're welcome. Are there any other questions?
You've been really helpful. Thank you.
Okay, good. Thank you for saying that. Was that enough Medicare for everybody for today?
Yes, thank
Yes.
you.
Yeah. Okay. So I thank you for your attention, and please feel free to contact us. Anything Medicare, we can help you with that.
Could you just repeat the number once more? Contact you.
Sure. It's on the last slide here for the Department for the Aging. 212-AGING NYC,
Mhm.
212-244-6469
Okay, gotcha.
for
Thank
New
you.
York City residents.
Okay.
Okay.
Thanks again.
Okay. Thank you. Appreciate it.
Bye now. Thank you.
Okay. Goodbye.